All right. So finally, you have the rotation range of motion. So for this one, what you're going to do is take your goniometer using the proximal arm. You're going to put the center right on the middle of the patella, and then you're going to follow the motion of the leg with the distal or dynamic arm. So for lateral rotation, you're going to take and push the ankle outside. Good. And then let them relax. For this, anywhere from 0 to 35 is a normal range of motion. Here we have about 15. You don't want to push too hard when it comes to the lateral rotation because that setup can make it very easy for an athletic trainer to cause a dislocation if they push the leg too far. So just want to be very careful with the lateral rotation due to the mechanism that it could have on the hip joint as a whole. Then you're going to do the same thing, line it up on the center of the patella again. All right, you're going to hold that proximal arm where it is, and then you're going to go with the ankle to the inside, following with the distal arm, and then good. And then you're going to measure that out again. For this one, average is 0 to 45 degrees, and we've got about 23. So that is all of the range of motion that goes in for the hip. And then the biggest things to make sure you're doing is just kind of know the athlete as you go. So each individual person is going to have a different range of motion that's normal for them. So you want to make sure that when you're checking an injured area, also go ahead and get that bilateral measurement so you have something to work off of. So if for some reason, say they have really wild unflexibility in the hip joint when it comes to flexion, but that's matched evenly on the uninjured side or unaffected side, then maybe it's not necessarily that there's some sort of impingement or problem with the flexion or in the hip joint there. It's just that that person's really unflexible when it comes to their hip joints, which could be part of the problem of why they got hurt. So it's really good to know those things and work those into your training plan as you work with athletes in the rehab portion after they have been injured or prior to injury to help prevent those. So thanks. That is everything.